Hi, I'm Bruce Moody, and I'm with Military, Community, and Family Policy. We're a Department of Defense agency, and we help service members and their families navigate military life. We're the ones who bring you Military One Source. I'm outside today because it's a beautiful day. It's a beautiful autumn day. And of course, in the autumn, there are two very important things to think about. One is whether or not we want to put pumpkin spice on everything. And frankly, I don't think that we need to do that. But the other really, really important thing to do is to be thinking about the flu shot, the seasonal flu shot. And that's what we're going to be talking about today. You know, there is, of course, COVID-19, and that's why we do these updates every day. But in addition to that, there is the seasonal flu shot. And we're going to talk about that today with our guest, Ann Morse, who is a registered nurse and a board-certified family nurse practitioner. So she works at the Defense Health Agency's Immunization Healthcare Branch and is a provider at the North Atlantic Hub's satellite office at Naval Medical Center in Portsmouth. Great to have you with us today.
Thank you. It's great to be here.
It's great to have you with us today. This is a really important topic. You know, for the last 9 months or so, we've been incredibly focused on the coronavirus, on COVID-19. But as I want to talk about this with you today, we need to keep an eye on the seasonal flu and how to avoid getting it. Can you talk about that, please?
Yes, I can. I wanted to start off by telling you exactly what the flu disease is. The flu disease is actually a respiratory virus. It's very contagious, and there are multiple different types of viruses. The two most important ones that we deal with are type A and type B. Type A is the most virulent. It infects humans, animals, cows. B is the only one to affect humans. So we'll only see that with us. But all of them can appear throughout the year. The most deadliest times for us start in October. Our flu season starts October, say 2020, and we'll go through May 2021. Typically, A is seen the first part of the season, the winter, early spring months. That's when we'll see most of our tests come back positive for influenza A. Influenza B, while it can be year-round also, typically shows up towards spring, late May timeframe. And as I said, it's an airborne disease, and it can occur from coughing. So people who are coughing, sneezing all over the place, they have a cold. That cold is different than the influenza virus. People commonly mix up the two all the time, saying, my cold, I have the flu. The severity of your fever and your symptoms, if you have a runny nose and itchy eyes, that's not flu. That's more of a cold. The virus is spread, as I said, by coughing throughout the room. If you're in direct contact, person to person, say you and I were face to face with each other, and I coughed or I sneezed, and you're within 6 feet of me, there's a risk you can pull in that virus as you breathe in normally, and you never even know it. It can live up into the air for about an hour. It can be on hard, non-porous surfaces for up to 2 days or more. Even that dry paper, you have tissue paper in your hand and you wipe your nose, it can be on there for about 15 minutes. And if you sneeze into your arm, which is what we do kind of recommend now, that lives there for about 5 minutes. So you just need to pay attention to what you're touching and what you're doing. Our incubation period for the flu, you're symptomatic 1 to 2 days before you start having symptoms. And then when you have symptoms, you can spread it for the next 1 to 2 days. But you can be contagious. Adults can be contagious for a week. Children can be contagious for up to 2 weeks. So we all have to pay attention and go after and get a flu vaccine.
So that's a good point. And can you talk a little bit more about that? Why it is so important for people to get vaccinated, in particular for the seasonal flu?
Well, Influenza and pneumonia, which is the number one complication from the influenza disease, is the 8th leading cause of death in the United States for both adults and children. So it's very high. Most people don't even pay attention to it, not even realizing how deadly it is. And if you're asymptomatic and you have no symptoms, because a lot of people say, I never get the flu, I don't get sick, you could be a carrier. And now there's a risk that you could transport that disease to somebody who's a little more susceptible to it. So say you have a child that has asthma, or a elderly parent who has high blood pressure and diabetes and COPD and other blood disorders, they're at a higher risk. So the disease, they're much more likely to have complications. Also, think about your loss of income. If you got the disease, you're already seeing it now with COVID. You can't work. You're stuck in the house. Your friends are sick. You're sick. You've got loss of income. You're out of work. Kids aren't at school. I mean, last year we saw almost 18 million medical visits just going into the doctors for the flu-like symptoms, when 38 million had also, it's a combination of medical visits and going into the hospital. There were over 400,000 hospitalizations, of which I do know 22,000 were pediatrics, and they died. So people don't see the death rates that come out of the flu because it's thought to be so common that nobody really pays attention to it. So those are some really big reasons why is loss of income, loss of social networking, your health, and then you end up with complications. So if you end up with pneumonia, you could have respiratory problems the rest of your life. So we really want to make sure people get vaccinated. And as I said, if you have just one risk, such as asthma or diabetes, you're up to 20 times more likely to have a complication from the flu. And if you have 2 or more, you're 80 times more likely to have a complication from the flu. So think of those numbers. You don't want to be part of that number. And one of the best ways to stop it is to get the flu vaccine.
Well, you're definitely convincing me. I don't want to be on that side of the column. But can you talk a little bit about, side effects? Any side effects that people might want to be concerned about?
The normal side effects to a flu vaccination, up to about 64% of us will have a local site reaction, such as my arm is sore, I got a red spot, I've got some swelling up in the shoulder, and it's up in this deltoid area, up through here, the fatty portion of the arm. If the technician gave it correctly, you don't have any problems. We do have some that it's a little bit high, so they end up with some shoulder pain and an achiness. But even if given correctly, that achiness, the headaches, the body aches, the mild fevers under 102 degree, the joint pains where I feel uncomfortable, that's your immune system working. And it actually means you've got a good immune system. It's doing its job. That's what it's supposed to do. And people notoriously associate that with the flu vaccine gave me the flu. And it's actually your immune system working. Now, if you are diagnosed with the flu immediately after your flu vaccine, within, say, the first 3 to 5 days, you had already been exposed to that flu virus prior to your vaccination. The flu vaccine does not give you the flu disease, but it can make that disease, if you already have it, show up, because now you've doubled your immune response.
Interesting. Other responses, preventive strategies. Besides getting the flu vaccine, what can people do or be mindful of during the flu season to reduce their risk of contracting the flu?
Well, for the last dozen years or more, we've always recommended good hand washing. We're doing it now with COVID. Hand washing, sanitizing, using the little hand sanitizers, washing your hands in warm water, and not just rinsing underneath the water. Rub your hands together. Rub between your fingers. Us women with our beautiful long fingernails, remember to wash your fingernails, okay? Because the virus can live underneath there too. So you want to make sure you wash your hands really well. And if you think you've touched your face, wash your hands. Wear the mask. Masks are excellent in preventing the spread of the aerosols. Remember I said that we can spray up to about 6 feet if you cough or you sneeze. And studies have shown that that spray can hold anywhere from 40,000 up to 5 million particles, depending upon how strong a sneezer you are. There are studies out there that show that. And those are some high risks. And when you wear your mask, you need to wear your mask over the nose, up over the top of the nose, not underneath it. Because if it's underneath, you're just breathing in normal air as if you're not wearing it at all. So we try to encourage people to wear it up. For us that wear glasses, I know people say I can't see when the mask is under there. Just pinch it over underneath and just set it just underneath the tip of your glasses. Those are some good tips. The other way is to get vaccinated. Vaccinations are encouraged. We like to get it done here in October because we've been noticing that the peak flu season has been coming up in December lately. But here in the Northern Hemisphere, our highest peak is typically January and February. So you can get a vaccine at any time. The one thing to remember about your vaccine is it takes 2 weeks, 10 days to 2 weeks before you have antibody protection. So just because you get it, don't think you're automatically protected that second. Your immune system takes about 2 weeks to develop memory cells to remember how to go after that vaccine or that virus. And then we've got the list here of other things on the benefits, reducing the risk, loss of work. Okay.
Okay. So let's talk for a little bit about the Department of Defense policy. So what is the policy on the influenza vaccine as we're talking about active duty service members, civilians, TRICARE beneficiaries?
Per DOD, they follow ACIP and CDC guidelines. Everybody over the age of 6 months and older should be vaccinated with the flu vaccine. The DOD is mandating that all military personnel active duty, and this has been even before COVID hit, get a flu vaccine. And we're recommending it for all their beneficiaries. It's also required or recommended for civilian, GS personnel, and our goal is to get everybody vaccinated, or at least 90% vaccinated by mid-December, if not mid-January, depending upon which service you're in. And you can get the vaccine at any of the branch medical clinics or hospitals. I know many will say this year it's not there yet. Correct. The DOA, that's our logistics service, they receive the vaccine from the manufacturer. And the manufacturer has just sent it into our agency. So they should be able to get it out by the end of November. So that's when all the branch clinics should have it. If you can't get the vaccine or you don't want to wait, which you don't have to, you can, with TRICARE, follow local policies. You can go to a local pharmacy and select which vaccine you want, whether or not you want the nasal, which is up the nose, or whether or not you want the injectable. And there are lots of different injectable vaccinations that are out there. So you can go to your local pharmacy, you can use your own healthcare provider, you can go to one of the branch medical clinics. And the military will supply all active duty service members their vaccines, but they are welcome to go out through TRICARE also. If they do need to bring that lot number, the date they got it, the manufacturer, to their command so they can document it in their records, and that'll get them off their hit list.
Got it.
You know what that is.
Well, yeah, I'm retired military, and I have received many injections. I suppose I came in with a fear of needles, but at some point it's just like, you're gonna get a lot of shots in the military. It just happens, and they do a wonderful job. But you do mention the nasal version. So are there different types of the vaccine or different ways that it's administered? And is one type of administration better or different in the way it behaves in the body from another? Say a nasal versus an injection, is one more effective than the other?
No, they all work the same way in that they give you antibody protection. The flu mist is a live virus vaccine. All the injectables are inactivated viral vaccines. And while live virus was thought to give you a better immunity, studies have shown that they do give the same protectability as all the other flu vaccines. A couple of years ago, the flu mist was held for a little while, and further studies were required to check its effectiveness. And it was identified that one of their influenza A viruses was not the best strain to pick for the vaccine. And once the manufacturer corrected that, it has the same protectability as now all the injectables. But DOD has not ordered the flu mist, which is why we don't have it. Remember, it takes 6 months prior to the onset of the flu season for manufacturers to start making their vaccinations. So we have to put our orders in January and February for the next year. So if flu mist got approved again in March, we've already got all the injectables ordered. So, but you can go to a TRICARE facility and get it. There are some restrictions for ages for flu mist, or if you have certain health conditions, you can't get flu mist. It's not recommended. So, but any injectable vaccine is allowed. There are 2 egg-free vaccines for those people who feel that they have an egg allergy and can't do it, Flu Block and Flu Vax. And you can just ask any pharmacist for the egg-free flu vaccine, and they can provide you with that if you have concerns on that.
Okay, so those are really important concerns that I didn't even know were concerns. But are there other concerns? Why are some people just hesitant to get the flu vaccine?
Well, we've discussed a couple of them already. One is I get sick after the vaccine. You get the normal side effects that are seen following a vaccination: fever, chills, body aches. Other ones are I'm allergic to the ingredients. I have an egg allergy. Well, it's now shown that even those that are truly anaphylactic egg allergy patients can safely receive it because the amount that's in there is so minute that your body doesn't even recognize it. But we recommend those people get it at their doctor's office or someplace that has medical care in case something does happen. Some other ones is it doesn't work. I still get it. You know, I get the vaccine and then I get sick again months later. Well, remember, there are different strains of flu out there, and we're protecting you against 4 of the most virulent ones that are coming around. So if it happens to be a different strain of flu, you may end up with some of those symptoms, but if you didn't get the vaccine, think of how worse you might have gotten. The symptoms may have gotten a lot worse. So the vaccines will help with those. And then others have concerns on social media, and some have religious concerns. And they can talk with their docs about those, or they can talk with the chaplain or their religious hierarchy, whether it be Muslim, Islam, Protestant, Catholic. Talk with your chaplains. And okay. You can even talk with us. We will help you with that too. And we can give you our contact information at the bottom, at the end of this program.
Yeah, we'll absolutely do that. We'll go ahead and we'll post some contact information for folks who just have more questions about getting the vaccine. But really appreciate you being being with us today. Do you have any last thoughts on this topic?
with COVID going on right now, it really is important that we try not to have a second epidemic going on with people having the flu, because you don't want to end up in the hospital with COVID patients and end up infecting both the staff and your loved ones who are trying very hard to protect all those COVID patients right now. So let's all try to get vaccinated so that we can keep ourselves nice and healthy.
Ann Morris is a registered nurse and a board-certified family nurse practitioner. She works at the Defense Health Agency's Immunization Healthcare Branch, and she's a provider at North Atlantic Hub's satellite office at National Medical Center in Portsmouth. Thank you so much for a really interesting conversation. I appreciate you being with us today. If for those of you watching, if you have any questions or any comments and anything you want to share, absolutely post your comments. We will absolutely get back to you. Thank you so much for joining us today. Bye-bye.
All right. Bye-bye.